You are enrolled in courses preparing you to study a particular specialty within healthcare. You're committed to caring for your future patients safely and compassionately. Are you committed to caring for the planet as well as your patients? Have you thought about the waste that your intended specialty produces every day with every procedure? The United States leads the world in production of healthcare waste. The U.S. produces between 5 and 6 million tons of healthcare waste every year, and that number has increased since the COVID-19 pandemic. What exactly is included in that number? Healthcare waste is defined as all waste produced by healthcare procedures, and it includes hospital waste as well as that produced by laboratories, homes, communities, research centers, dental clinics, and veterinary care centers. A large portion of this waste is composed of single-use plastics, and these either decay into microplastics if put in a landfill, or produce toxins such as dioxin if burned in an incinerator, currently the only way to destroy plastic. Healthcare waste is damaging to our individual patients. One person who recently spent over a week in the hospital said that the waste piling up in her room was a major cause of anxiety and that she worried about what would happen to the waste when it was taken away. It used to be that healthcare facilities used items multiple times, and none of those items were plastic. Have you ever thought about how many single-use plastic items are used in your intended specialty? Consider the blue wrap used with every surgical procedure, along with all the other packaging that is discarded with each procedure. Think about the basins, the water pitchers, the syringe, and the gloves. Each specialty produces its own share of single-use plastics. So what do we do with the plastics we produce in healthcare? Well, some of it is incinerated or burned in a special furnace, which releases toxic chemicals and contributes to climate change. A smaller amount is recycled, although items cannot be recycled indefinitely since the quality of the plastic decreases each time, and recycling also produces toxic chemicals. Most of the waste produced in the U.S., including healthcare waste, ends up in landfills. Landfills not only produce methane, a major cause of climate change, but they also lead to the breakdown of plastics into microplastics. Microplastics are everywhere, including in our own bodies, and we don't know what effect those microplastics are having on human and animal bodies and on the planet as a whole, our most important patient of all. Estimates are that by the year 2050, plastics will outweigh fish in the ocean. You may wonder how you can get involved in the fight to reduce healthcare waste. Well, you can talk to your instructors and those at your future clinical sites about the problem, spreading the word about the dangers of healthcare waste. You can also propose a project on healthcare waste to your campus's green team, such as switching from plastic medication cups to paper ones. You can find your campus's green team by searching the ACC website for Green Team. Let's get going on reducing single-use plastics from our labs and healthcare facilities. Together, we can make a difference for our patients and our planet.